Hello students, very good evening. This is your very own ENT faculty, Dr. Sarvejeet Singh, and I'm going to discuss the INI-CET recall questions which were asked today, that is on November 2023. Now, many a times we think that the ENT paper is, ENT questions, there are going to be only 2 or 3 questions. That was the first response that was given to me by the students who came out of the INI-CET exam, and I was standing outside the hall. But we always tend to remember the difficult, the tough questions which are asked, and many times we forget the easy questions. And today INI-CET, the questions which were given in the paper from ENT, I'm surprised. This I think is the maximum. I got around 11 questions till now, which I have got of ENT. Of course, 2 or 3 are overlapping questions, but the remaining questions are pure ENT questions. So generally, we get 5, 6, 7 questions of ENT. Even if they are overlapping or integrated questions, but today I got around 11 questions of ENT that came in the exam today, right? So, so many questions came, and the best thing was that all the questions were direct questions, even though some were clinical, some had histopathology images. They were all direct questions. There was nothing that was hidden. There was no hidden surprises. There was nothing which was new. Right? So many questions came. Let's discuss the question and we'll discuss each of these questions in detail. Let's go ahead, shall we? Yes, so this is the first question which came, straightforward question. Hindi mein what do you say that? Ki, for ENT, if you have seen my videos, if you read the notes, तो आप लोगों ने आकर के जरूर बोला होगा कि लप्पू सा पेपर आया था और झिंगूर से क्वेश्चन थे. Similarly, straightforward question. One-liner questions, direct images, nothing, just pick it, mark it, go ahead. Okay, so the first question, identify the type of joint marked in the given image. So ossicles दी हुई हैं friends. We have the ossicles, the ear ossicles, and I've taught you that the joint between the ossicles is the synovial joint, and the arrow was marked over here at the inguinal joint. Okay, so you can see over here, and we know that this is saddle variety of synovial joint, and incudostapedial joint, this is ball and socket variety of synovial joint. Okay, both of these are saddle varieties. So answer to this question is saddle joint. Straightforward question, very easy question. Okay, second question was asked. I'm looking at the chat. So friends, if you are there, you're watching me, just give me a thumbs up if you're able to get the questions, and write. If you think that some choice is little wrong, okay, although I have tried to get almost all questions with the right language, because even a single language alphabet can change the answer, and such as in this question that I am going to discuss. So if you find that some language was different in the question, or you see that some choice was different, please feel free to just write it. Okay. Now second question, and this question I have a doubt as well, because I'll tell you the image, if there's a little difference in the image, that can change the answer. A 33-year-old male presented with URTI, upper respiratory tract infection, with pus in the left nasal cavity and orbital pain along with blurring of vision. Okay, so that means there is a, there is a URTI, there is pus, so patient is having sinusitis. And now there is blurring of vision, there is orbital pain, there is blurring of vision. So what is this? This is a question of complication of sinusitis, right? CT scan was done and following findings were seen. Now over here, whether CT was given or maybe the MRI was given, I am not sure, what is the most likely diagnosis? So it is not just sinusitis, it is complication of sinusitis. So first option is definitely out. Now, it can be, different types. We have, periosteal abscess, subperiosteal abscess. We have orbital cellulitis. We can even have orbital abscess. Now, you see, subperiosteal cellulitis or abscess would have been over here. Okay. Now, this you can see that there is a definite proptosis. There is bulging of the orbit, plus there is blurring of vision. So that is seen if there is orbital cellulitis or orbital abscess. Now, orbital abscess was not there in the options given to me. Plus over here, I cannot see any frank abscess in the cavity. I am not able to see any frank abscess in the orbital cavity. So if there is no frank abscess, there is proptosis. So only answer that is left to me is orbital cellulitis. However, depending upon the image, this answer can change because blurring of vision can be seen both in orbital cellulitis as well as orbital abscess. Okay, you see this is a patient of subperiosteal abscess that you can see over here. So I have just kept these images that you can guys just write to me in the comment section and tell me, sir, this image was there. It was looking like subperiosteal abscess? No. That what students have told me. Or was it looking like orbital cellulitis? So this is an MRI as well as a CT scan you can see over here. So in this you can see the eyeball is protruding out. So something similar to this image I found that the students sent me, right? Okay. So this kind of image I am seeing in the question. So I have labeled it as orbital cellulitis. Okay. However, if it was an orbital abscess, then you can see over here there is a frank abscess. Okay, you can see subperiosteal abscess as well as there is a orbital abscess also. So sometimes in the orbital abscess, this is an orbital abscess. This again is a frank abscess. So frank abscess was not seen, right? Okay, so frank abscess was not seen. So that means it is a case of orbital cellulitis, right? Okay, next question. Now I'm sure this question even the dermatology faculty must have discussed with you, right? Because this question it came in the dermatology, it's an overlapping question. So whenever we have these kind of overlapping questions, I teach dermatology, sir, Dr. Manish also teaches it. Apocrine glands are seen in straightforward one-liner question, face, scalp, palm and sole or axilla. So I to tell you apocrine AAA, the mnemonic is AAA. Okay, atypical apocrine adrenergic fibers, and they are found in AAA. What? Axilla, areola, anal, perianal, circumanal or perianal, right? Remember, so answer is axilla and pubic areas. Remember 4 places I tell you, axilla, areola, nipple areola, anal, so circumanal, okay, and pubic area. So AAA, remember the AAA mnemonic, apocrine atypical sweat glands and adrenergic nerve fibers, right? Okay, next. Question number 4, again straightforward, and this was a repeat question that came in the exam. The image was new, I agree, but you don't get the same images like that. A 60-year-old patient presented with following lesion which is slowly progressively increasing in size. So you see 60-year-old man, elderly patient, and you have a lesion on the face. This looks like say ulcer, and this ulcer you can see that there are rolled out margins. So this is again an overlapping question with dermatology once again. Okay, so answer was BCC. We have studied this, BCC, and most common malignancy of the skin, right? Very common on face and hands, on the dorsal side of the hands, right? Exposed to ultraviolet B rays. All right, next question, question number 5. Now this question, I think it's an overlapping question between radiology because the X-ray was given to you. But yes, it's a pure ENT question. A child was playing alone and is found to be drooling and choking. X-ray is done and is shown below. So what is the likely? So you see that the question generally asks is that where is the foreign body? Now you see over here, instead they ask what is the likely foreign body ingested. And I have taught you in my lectures, I have taught you multiple times that whenever you see a coin or a ring like foreign body, circular foreign body, what you have to see, you have to very carefully, and this is one thing that we have to, as a clinicians, we have to see over here, there is a ring in ring appearance. Okay, there is a double ring or a ring in ring appearance. And whenever I see this X-ray, it's an alarm in my mind because this is an emergency. Coin you can wait for 2 hours, 3 hours, but this is an emergency because this is a button battery. Okay, this is a button battery. How can you determine, how can you confirm? You can confirm by looking at the lateral view. What do you see in the lateral view? It gives you a stacked appearance, as if there are 2 coins. Okay, so as if there are 2 coins, there is a stacked appearance over in the lateral view. And this is very important. Why? Because this is a time bomb. I always say this is a time bomb. Why? In 2 hours it starts leaking. And in next 2 hours it causes perforation. And in next 2 hours it causes mediastinitis. which is a life-threatening complication, life-threatening infection. So friend, this is an emergency. You can't wait even for the child to become 6 hours nil per orally as per anesthesia, general anesthesia requirement. You have to immediately take, and you cannot wait for 6 hours. In a coin, the anesthetist will ask, okay, let the child become NPO for 6 hours, then we'll give the GA, and then we'll take the patient to the OT, give GA, and then you can take out the foreign body. And we are happy to wait for 6 hours. But in case of foreign body, which is a button battery, we say no. 6 hours, a lot of things will happen and things will go out of control. So we have to take it out immediately. Right, friends? Okay, next question. INI-CET paper is incomplete without autosclerosis. They have to give a question of autosclerosis, and it generally comes as a clinical question. How? You see, a lady presented with bilateral hearing loss. You see, bilateral hearing loss, more on right side. It was decided to do stapedectomy after examination. So stapedectomy is the treatment plan. That means it is a case of autosclerosis. Straightforward question. You cannot get a simpler question than this. What is the likely Reni's and Weber? So we know autosclerosis is a disease where we have conductive hearing loss. And it is a bilateral disease. So patient will have bilateral conductive hearing loss. That means Reni's in conductive hearing loss is negative. What about Weber's? So you see, Weber's, hearing loss is more on right side. Which kind of hearing loss? Conductive hearing loss. So we know Weber's goes towards conductive hearing loss. And out of right and left, right is having more conductive hearing loss. So Weber's will go towards the right side. Yes, so answer is bilateral Reni's negative and Weber's going to the right side. Okay, 7th question. I'm not able to get all the 4 choices in this. So I would like you to, give me the choices, right? So all of the following statements are true except 1 layer cells in inner hair cells and 3 layers in outer hair cells. That's true. We have discussed the differences between inner hair cells and outer hair cells in my lecture. And we know that the inner hair cells and outer hair cells, the difference, I have told you, outer hair cells, the mnemonic is more. Okay, outer more. O, I have told you, O more. What is more? More in number. 13 to 14,000 in number. Okay, inner hair cells are less in number, 3,500 number. Okay, now outer hair cells more in rows, 3 to 5 rows. Inner hair cells 1 single row. So this statement is correct. Okay, now we have also seen the diagram in the physiology. We know that the outer hair cells, they lead to electrosomatic motility. Okay, so we have discussed that there is a special protein inside the wall of the outer hair cells, and that leads to electrosomatic motility. Whereas the inner hair cells, inner hair cells, 95% fibers. This also I have told you, 95% fibers, they supply the inner hair cells, and they are responsible for efferent nerve fibers. Whereas outer hair cells, they are efferent nerve fibers. Okay, and they receive only 5% of supply. So this statement is also correct. Now the third statement, I didn't get a complete statement. It was about the outer hair cells, sense movement, or whether it was because of the efferent fibers. So based upon that, this statement may be true or false, and I am still waiting for the 4th option. So friends, do write to me if you know the 4th option. Please do that. Okay, right? All right. Let's go ahead. So students who are watching this video, Dr. Abdul, Dr. Nikhil, Dr. Juhi, Dr. Suhotra, can you just fill up the last choice? Is this question rings any bell to you? Does this question rings any bell to you? Dr. Para, Dr. Sri Krishna, Dr. Sunil, whosoever is there, please, I'm waiting for you. Okay, can you just write me the options? If you remember this, I'll be happy. Please do write to me the options that are there. All right, no worries. If you don't remember it right now, no worries. We'll have it later on. I can come back to this question. Let's discuss the other questions. Question number 8. Now this again, so I think 2 or 3 questions were overlapping between ENT and dermatology. A HIV positive patient presented with white non-scrapable lesion on the lateral border of tongue as shown below. So you can see which of the following is most likely. So what is this diagnosis? It is non-scrapable. Answer to this is oral hairy leukoplakia. Okay, oral hairy leukoplakia, and this is caused by Epstein-Barr virus. All right, I think Dr. Manish has already discussed this question with you, so I will not go into much detail into this thing. Right, let's go ahead to the next question. Now question number 9, and this is a pathology overlapping question. Okay, although I'll say it's a pure ENT question because we have discussed this in detail in our lectures. A patient presented to ENT OPD with unilateral nasal mass causing obstruction and occasional bleeding. The mass was removed and histopathology shows the following finding. What is the most likely diagnosis? So what do you see over here? You see that there are a lot of sporangia, right? Okay, so unilateral mass, occasional bleeding. Now, the confusion is generally between two things, rhinoscleroma or rhinosporidiosis. So that is why students had put these two options to me. I don't remember the remaining two options. I don't know them because students didn't remember them. They were confused between two of these things, rhinoscleroma or rhinosporidiosis. So rhinoscleroma generally tends to be bilateral, number one. Number two, it will always have atrophic rhinosinusitis-like findings. Like there will be atrophy, there will be crusting, okay, there will be foul smell. So all that will be mentioned in the history. Okay, whereas rhinosporidiosis, you know, the nasal mass is there. And I think one of the students told me that this nasal mass, they had mentioned strawberry-like mass. So if it's a strawberry granuloma, that clearly points towards rhinosporidiosis. So I am not sure whether strawberry was there or not. So that is why I have not mentioned this strawberry-like mass. If it was there, then the question was pretty straightforward. Just on the basis of history only you could have solved. Okay, if this was not there, then you know you look at this histopathology finding and that is clearly in favor of rhinosporidiosis. Okay, sometimes they give you a history of rhinosporidiosis that the patient belongs to the, you know, it is found in southern coastal India. So southern coastal Indian states like, you know, West Bengal, Odisha, then we have Andhra, we have Tamil Nadu, okay, or you can even have Pondicherry, or it belongs to Bangladesh or Sri Lanka. So that's the only place where we have this disease. The disease is found in rural population or people who take bath in the pond. So if any of that was mentioned in the question, please let me know, okay, because then that makes the history, you know, even more pointing and definitive towards our diagnosis. All right, let's go to the next question. Okay, so I think I have marked question number 10 over here. Upsloping audiometry is seen in. So we know that the upsloping audiometry is seen in endolymphatic hydrops. So that was the option, students remember. It's a pretty straightforward question, right? Whether it was a image based question or a straightforward one liner, I am not sure. Okay, so just let me know because students they just told me, sir, that this question came in the exam. So do let me know if this was a, you know, IBQ image based question. That will make it a little more interesting because generally INI-CET people are not, you know, fond of giving 2 or 3 words question, one liner question like that. We know that upsloping audiometry is seen in Meniere's disease, also known as endolymphatic hydrops. Okay, we can also have a downsloping audiometry, that is, so upsloping is also known as rising curve. Downsloping, that is seen in presbyacusis. Okay, it is also seen in ototoxicity. In both of them, you know, they are bilateral, downsloping. Of course, in Meniere's disease also, in later stages, it becomes downsloping, but there it is unilateral. So late Meniere's disease has downsloping, but early Meniere's disease is upsloping. So answer is endolymphatic hydrops, right? Okay, question number 11 that we have. A patient recently recovered from COVID-19. Now, you know, this question is a 2-year-old question. It's a repeat question. Okay, now why? Because this question came, you know, in 2021 when we had the Delta wave, the second wave of COVID. lot of patients had mucormycosis, and this question was there in almost all the papers. At least 2 or 3 questions came in one paper. So it has come from there. I was surprised to see such a question, a repeat PYQ. At this time when we don't have, any more COVID-19, we have COVID-19, but we don't have these cases now. So a patient recently recovered from COVID-19 who was treated with steroids. After 3 weeks, he complains of nasal discharge. Swab collected and following image is seen. So what you can see over here aseptate fungi. Okay, you can see over here aseptate fungi. So one of these images, I think this image was given. I have kept all the 4 images, but this image was shown over here, I guess, or maybe this image was given. I am not pretty sure which image was given. So I have kept both the images over here, and I'll still wait for your response to tell me which image was there. Right? So aseptate fungi was there. Okay, obtuse and at right angles. So that is the answer. The answer was pretty clear. It is mucormycosis, COVID-19, post-steroids, and we have something growing in the nose. The answer was mucor. Okay, that's a straightforward question. No brains applied for that. Right? So these were the questions that were from ENT. I've tried to complete the questions as much language as was possible, try to give the right images, try to give the right options, but still I know it's a very short time that I got in between, and there are some things which are missing over here, some components. Maybe I have missed some other question also. I understand it's already late and you are tired, but I'll wait for you. Give me the answers, right? Give me the right options. Thank you very much and best of luck. Don't worry, this paper, INI-CET paper, sets the tone for the NEET PG paper. I always say that, because even if you are not aiming for INI-CET, it tells you where your preparation is right now. And you still have 4 months, November, December, January and February. The exam, as announced, is slated to be in March. So you have 4 good months. Out of these 4 months, at least 2 months you can utilize to complete the course if you are left with any course, and 2 months you can give for revision. And if you have completed your revision, your course till now, you are at a very good stage. The remaining 4 months you can just put for revision, and if you put 4 months for revision, you are definitely going to crack the NEET PG. All right. So it's a win-win situation for everyone. People who have not finished the course, as well as people who have finished the course. You can still make a lot of difference in your NEET PG. Don't worry about the INI-CET score, because there's a lot of difference over there. And there are people who are very happy, who have given the question paper very nicely. I wish you best of the luck. As I said, for ENT, this was a Lappusa paper and Jingur se questions. Okay, so best of luck, guys. See you next time.